Hello, my name is Alice Liang, here with co-authors Tiffany Thang and Yechan Choi from the University of California, Santa Cruz to present our work in collaboration with Hope Services on providing and accessing support during the COVID-19 pandemic, outlining and describing the experiences of mental health professionals, community and vocational support providers, and adults with ASD. The COVID-19 pandemic has resulted in an increase in the use of telehealth and virtual technologies to continue providing support services to individuals with ASD. Many community centers that provide support services to adults with ASD closed for in-person services to protect the health of their clients and employees, switching to providing services through telehealth and virtual technologies. Previous research regarding the impact of the COVID-19 pandemic on individuals with ASD have focused heavily on its effects on children and their caregivers or parents, with few studies discussing the impact of the pandemic on adults with ASD and those who provide support services to them. In our study, we examined the impacts of the pandemic, telehealth, and virtual technologies on essential service providers supporting adults with ASD, and adults with ASD through interviews with these individuals a year into the pandemic. We collaborated with Hope Services, a community center for adults with developmental disabilities, servicing California that provides mental health, vocational, and community support services. We work with two branches of the center, providing services to primarily suburban and rural regions south of the San Francisco Bay Area. And further information regarding our participants will be discussed in the following slides.
Essential service providers interviews consisted of 5 mental health professionals and 5 vocational and community support providers. We asked them questions regarding their experiences providing services through telehealth and virtual technologies, and the excerpts from these interviews are included on the slide. The themes identified within these interviews included changes in session times, technical issues, stress, and connectedness, and the distribution of each theme within these interviews amongst the type of essential service provider is shown in the Sankey on the slide. It is noted that essential service providers expressed a lack of necessary training during this transition to telehealth and acknowledged that there were technical issues, including lack of reliable internet connectivity, resulting in difficulties providing services to clients during the pandemic, especially at the same level quality as in-person services. Some quotes from these interviews include, "If I had access to training, that'd be helpful, but I'm hoping to transition out of telehealth, and I don't know if we have the tools we need to provide effective services to clients." Our study also included interviews with 4 clients from the community center who received services in Santa Cruz and Santa Clara counties in California, highlighted on the map shown on the slide. Clients lived in suburban or rural parts of these areas and were interviewed on their experiences accessing remote services from the center during the pandemic. They described difficulty with accessing services remotely, with one client saying, "I kind of had a difficult time trying to install Zoom on my tablet. We kind of had a crazy internet connection," highlighting challenges with the telehealth platform and reliable at-home internet. However, clients did appreciate the ability to stay connected to others through telehealth and virtual technologies during the pandemic, with one stating that, "It's nice to see some good friendly faces on Zoom. Even though it's remotely, I'm glad to see them."
From our study, we found that essential service providers lacked adequate telehealth training and found that the lack of features and tools available on telehealth platforms resulted in difficulty translating in-person support services to a virtual format. In addition, lack of reliable at-home internet services caused providers great stress, especially with respect to dealing with providing services during power outages and evacuations during wildfire season in California. For clients, lack of available technical resources, along with unreliable at-home internet services, resulted in a great deal of difficulty in trying to access support services. Although their experiences with telehealth and remote technologies produced some challenges, they were ultimately appreciative of the ability to stay connected with friends, family, and their essential service providers. Based on our findings, we believe that telehealth technologies should focus more on developing their platforms with respect to their specific user groups in mind, as opposed to a one-size-fits-all approach commonly noted amongst these technologies. In addition to this, further evaluation of the impact of telehealth and virtual technologies on the provision of essential support services for individuals with ASD during the COVID-19 pandemic should be conducted to get a better understanding of how we can better adapt and develop these technologies to address their needs. Our study provides a glimpse of the experiences of essential service providers and adults with ASD, but continued research into this will provide a clearer idea as to how we may improve telehealth and virtual technologies for these populations. Thank you. We'll take questions now.